what emergency services do. It's not something that you can prepare yourself for. It's not easy to be exposed to those kinds of cases. And so the structure of our profession is very difficult to really elaborate. There's a lot of qualities that we look for in a paramedic, just critical thinkers in environments where things can go terribly wrong at any second. As a person who has care for others, you can't do this job if you don't have empathy. The level of care that we give to these patients is very serious, especially once you get to the higher qualifications like emergency care practitioners and advanced life support paramedics. There's a lot of cases that they manage. For example, sick patients who might have been in ICU at one hospital and need to be transferred to the other. The role of the paramedic is to transfer that very sick patient to the next facility, and sometimes the facility might be in the next town, and other times it might be in another country. Basically taking ICU level equipment into a moving car or vehicle or airplane or whatever it is, and having to get the patient to the other side in a healthy condition. So your knowledge and skills and all of that needs to be at a level where you're able to handle that kind of pressure.
Hi everyone, my name is Tanya Boyson and welcome to the Come Up series. I am here with my lovely co-host, Lwanda Jacobs, and our guest today is Ncumisa Mayila, and she is currently studying her master's in emergency medical care, and she's a lecturer for primary health care. And today our topic will be based on emergency medical services and why it is industry.
That's impressive. That's impressive. Welcome, Ncumisa. Thank you for doing this episode with us.
Thank you so much for the invitation. I'm super nervous. I've never done anything like this before, but it's really great that we get to talk about these kinds of topics. I know a lot of people ask questions, and there's a lot of ideas around what emergency services is about, and I'm happy to share my experiences and what I know. So thanks for inviting me.
Cool, thank you. Please educate us today. So please tell us about yourself and your journey that got you into the EMS industry.
Okay, so I've always had, I would call it a keen interest in health services, whether it's healthcare or what have you. A lot of my family members are in the health sector. My mom's a nurse, my uncle's doctor, my other aunt is also a nurse. So my influences really formed sort of my interest in healthcare in general. But I didn't really know what avenue I wanted to pursue in terms of where I would fit in sort of the sector of healthcare as a whole. And I had taken a gap year after, struggling to complete my first degree. And I accidentally fell into emergency services because I was sitting at home, sort of trying to figure out what I would be doing with my time and how I would, move on to the next thing. And I did a first aid course. And during the first aid course, everybody was in the classroom. They were going around telling stories about, we had to introduce ourselves and say, why are we studying first aid? And everybody was saying, because I want to be a BAA, because I want to be a BAA. And I'm sitting there like, I have no idea what a BAA is. And now I'm curious about it. And I asked around, I was like, what is this BAA thing that everyone's talking about? Because I'm just here because it's a 2-day course and you get a little certificate. And I discovered that there's a whole world of pre-hospital care, emergency medical care, and that's how I started on the journey. And so I think that was 2013 when I started doing my BAA qualification. After the first aid course, I then went on to become a BAA, and yeah, it took off from there.
Would you say you're passionate about it? Was it like an untapped passion, and now you're passionate about what you're doing?
Definitely. I think in the beginning, I thought I was sort of doing it because it's a short course that I could, do for a little while and see how it goes. But I think it's the benefit of the way that I entered into the service is that I did the short course for 6 weeks and then I immediately started practicing on the road. And that exposure was a little bit of a shock to the system because you don't really know what happens in emergency services until you're in it. But as soon as I started practicing, it was like a light had been turned on and I was just so excited and so thrilled for every and anything. And I just wanted to do more and more and more and more and more.
So it actually sounds like a bit of adrenaline rush going on there during those processes.
Definitely.
Emergency on your hand there. Yeah, Tanya?
And what does the emergency services consist of as a whole, and why do you think this is a very important industry?
So the emergency services consist of I would say a few branches, right? Because there's the medical side, the police service also forms part of emergency services, the fire department, all of these departments that sort of help people in really, terrible situations. But emergency medical services in particular involves pre-hospital emergency medical care. And as well as rescue scenarios. So if a person, let's say, has drowned in the ocean, or a person is trapped in a car, or a person is stuck on a mountain, those kinds of rescue components play a big role in that. But also the medical part of it, obviously, is the one that everybody is aware of, where we respond to heart attacks, we respond to car accidents, we respond to people in sort of respiratory emergencies. We sort of the link in the healthcare system that is bringing the healthcare outside of the hospital, which is why a lot of the things that when we speak about it, it is emergency care, but it's also mostly pre-hospital care in a sense, because not every case is an emergency, but also a lot of it is. A lot of it is. And the importance of this industry is because we live in a country that has so few resources, and also just the history of emergency care as a whole. So if I can maybe take a moment just to explain the history of where we started as a profession. This is a profession that originated in the army, because there was a need for people to get medical care at the scene of the accident, or at the scene of where they were injured. So there was then a need that developed, where we had to train people. They had to train people. I wasn't there, obviously. It was a very long time ago. But they trained people to respond to calls and be able to treat medical conditions where the soldier is injured, or where the soldier needs it the most. And so that sort of care then developed to a point where sometimes there's not enough time for a person to be driven to the hospital to receive medical care. Sometimes treatment is so urgent and it's so serious that some sort of intervention needs to be done right there and then. And so the profession then grew from people being quote unquote ambulance drivers to then developing in their skills, developing in their knowledge, developing in the things that the capabilities that they'll be able to deliver to patients when they are in their homes, where they're at the point of care, basically, where they need it. And so the profession then grew from there, and it is what it is today, where we have multiple levels of care, from the most advanced paramedics on scene and stuff, and to the most basic ones who can maybe deal with cases that maybe aren't so intense. I don't know. Yeah.
Basically not so intense, because most of the emergency call outs is for things that are intense, like heart attacks, or what you call those impaled objects in your body. So
Exactly. And and also because our hospitals are so burdened, they're so overburdened with the large numbers of cases. It's important then for people to be able to receive that emergency care before they can get to the hospital. Because if we have, and truth be told, in South Africa, in an area where the hospital is just around the corner. If you're living in Cape Town, or you live in Johannesburg or Durban, there are so many hospitals that you can think of. If you got hurt or injured or ill, seriously ill, you could drive yourself to the hospital. And it's not, I know it's difficult to think about, but your distance from home to the hospital is not the same as someone who lives in the rural areas of KZN, in rural Limpopo or Eastern Cape, where people have to travel kilometers and long distances to get care. So that's where emergency services then come in, because they're able to deliver that kind of very important care that people need before they can, before they reach the hospital.
Sure. So Ncumisa, if one wants to become a paramedic, what advice can you give them to start? And the second part of my question is, can you also break down the different levels of becoming a paramedic?
Okay. So I'll start with the first part of the question, right? My best advice for anyone who wants to become a paramedic is to get involved. My first sort of exposure to this was something that I never could have imagined ever. Even if someone tried to explain to me what emergency services do and what kind of work they do, it's not something that you can prepare yourself for. The things that are seen on the road and things like that are intense, to say the least. It's not easy to be exposed to those kinds of cases. And so a particular type of person needs to be able to handle that, number one. So if you know that you volunteered a couple of shifts and you've had a ride along, you've been able to expose yourself to the environment of emergency care, then I would say that's probably the best place to start. And once you understand what it is that you're going into, there's a lot of qualities that we look for in a paramedic. I happen to work at a university, and the application process takes quite a bit of time, because it's a multi-level application process, where part of that is an interview, right? Where we speak to the candidates and find out certain questions, just to ask them, what is it about you that makes you the right person for this kind of job? Obviously, matric subjects are very important. We look for physical science, life science, mathematics, and English. and at different levels with different qualifications. And then thirdly, physical fitness is one of the biggest components of becoming a paramedic. There's a lot of running, carrying, climbing. It's very labor intensive and it's physically demanding. It's a very physically demanding job. So you need to be a person who can keep up with the fast pace of the job that you're going to do. Okay, so to explain the different levels, right? It's a little bit of a complicated situation right now, right? Because in the past, people could study short courses to qualify as an emergency care provider. Let's put the blanket term as an emergency care provider. So previously, you could study a 6-week course, which was a basic ambulance assistant. And once you qualify with that, you can then work on the road under supervised practice, and you can finish 1,000 hours. And once you do that, then you qualify to then study further and do another short course, which was a 3-month course, and you qualify as an ambulance emergency assistant. Once you qualify with that, you go and gain experience again, you work 1,000 hours, and then you qualify to become a critical care assistant. And so those are the 3 levels that were involved previously, which was basic life support, intermediate life support, and advanced life support. This is very complicated, guys, because now all of those short courses have been removed from the Health Professions Council of South Africa. So if you meet people who have that qualification, they already studied previously, but their qualifications have not been stripped from the board, right? But if you want to qualify today as an emergency care provider, you have to study at a university or an accredited college to do either a 1-year higher certificate, and that with that qualification, then you can practice as an emergency care assistant, okay? Or you can apply to study the Bachelor of Emergency Medical Care. Okay, I skipped one, but the Bachelor of Emergency Care is a 4-year degree. And once you do that, you're qualified as an emergency care practitioner. And in the middle of those two is the Diploma in Emergency Medical Care. That's a 2-year diploma. For now, it's 2 years. And you qualify then as a diploma paramedic, okay? There's also previously an emergency care technician qualification that was also 2 years. The structure of our profession is very difficult to really elaborate, but if you're talking about qualifications, there's one thing if you study the qualification, and then there's the board registration, which is something different, right? So with some qualifications, you might have qualified as a critical care assistant. You might have qualified in the previous diploma, which was 3 years, and those 2 qualifications will then register you as a paramedic on the board. Okay. And those are by definition what paramedics are, right, in South Africa specifically. But if you then studied the bachelor's degree, which is a 4-year degree, or you did the previous diploma and then you did a BTech, then you qualify as an emergency care practitioner, which is now the highest qualification that you can achieve in emergency care services, okay? And that is also advanced life support, but also a paramedic, but technical term is an emergency care practitioner. Wow. So there are a lot of levels to this thing, and it depends on your years of study and your level of qualification. But the term paramedic is basically used as a blanket term for everybody who works in this field.
Very.
I actually like the medical practitioner more, because this is actually like, as I was listening to you, it's like a very important role as a paramedic, because you are basically the first point of contact on the scene. And there's like a huge responsibility to get this person like stabilized into the hospital to get the necessary care. But in the meantime, you have to make sure that this person is stable enough and will survive until they get to the hospital. So it's actually, it's a very respectable and a serious and a huge responsibility to carry around. So I can understand why they actually upped the qualification or the requirements to become a paramedic.
Yeah, definitely. It's also part of our move to professionalizing the industry as well, because at the moment we're classified as a developing profession. But if the way that I'm explaining this, I'm sure you can understand that the level of care that we give to these patients is very, very serious, especially once you get to the higher qualifications like emergency care practitioners and advanced life support paramedics. There's a lot of cases that they manage. For example, sick patients who maybe might have been in ICU at one hospital and need to be transferred to the other. The role of the paramedic is to transfer that very sick patient to the next facility. And sometimes the facility might be in the next town, and other times it might be in another country. And so you might be traveling with these patients who are very sick and basically taking ICU level equipment into a moving car or vehicle or airplane or whatever it is, and having to get the patient to the other side in a healthy condition. So your knowledge and skills and all of that needs to be at a level where you're able to handle that kind of pressure and factor that in with all of the outside factors that come into dealing with a patient who is now in a moving vehicle, knowing that maybe they might have a fracture that's not stable. Sorry about the noise. But they might have fractures that aren't stable. They might have vessels in their heart or their lungs, anything that's sort of like these very sensitive cases. Sometimes we deal with neonates, which is like premature babies and very, very small babies that need to be transferred. And they have, these small organs and very sensitive details about them. And the paramedic has to know what to do if anything goes wrong and be able to manage that and bring the patient to the other side healthy, stable, like you said.
Sure. Yeah. What do you think draws people to this profession? And how do you think people should be mentally prepared? Or does it come with the job along the way that they become mentally prepared? Or do you have certain courses to help them be mentally prepared for this profession?
I think you guys mentioned it a little bit earlier that it sounds like a very big adrenaline rush all the time. It's always high stress, high impact, very fast-paced industry. So the people who are drawn to this industry and people who thrive in conditions like that, usually people who work well under pressure, people who are level-headed, mature individuals, people who are able to be critical thinkers, and also not only just critical thinkers in an environment that is calm and stable and safe, but also in environments where things can go terribly wrong at any second. It's difficult to paint an accurate picture of everything that a paramedic is going to experience when they go out there on the road. But the conditions are not the best, they're not the easiest, but you need to be able to focus and be able to do the task that you need to do to save a life, essentially. And because we're dealing with people's lives, I think one of the biggest character is a person who has care for others. You can't do this job if you don't have empathy. You can't do this job if you don't understand the gravity of what you're dealing with. A lot of the times I tell my students as well that you need to realize that you come into these people's lives at the worst moments of their lives. No one wants to call a paramedic. Nobody. There's no one in this world who is looking forward to going and visiting an ambulance or whatever. It's always the worst moment of your life that paramedics come into these moments. And I think that very, very strong aspect of being empathetic and caring for others, along with the other skills I spoke about, the critical thinking, when people under pressure, all of those things, those are the things that the kinds of people who are drawn to this industry, those are the kinds of people that we meet all the time. Okay. The second part of your question was about how we can mentally prepare people for this course and maybe not the course necessarily, but the industry as a whole. And I think it's very, very difficult. And I would say from the perspective of being a person who works in education and training paramedics and things like that, it's a difficult teach the theory and teach the students how to respond to a heart attack, teach them what to do when someone has asthma, what to do when somebody has been stabbed or shot or anything like that. But the reality of it is that no matter how much we can prepare you in terms of the skills, the motor skills to be able to do these things, a lot of the emotions that come with it are the ones that you get when you are faced with a breadwinner of a family for the first time. And this patient has a heart attack and he's not doing well. Those kinds of things stay with you all the time. And we encourage mental health. We encourage our students specifically, because that's the industry I work in, to seek help, to talk about these things, to say to the people around them, their colleagues and their mentors, that I'm not doing well, I'm not coping, I'm not okay. And it used to be that this is an industry for people who are tough, and it used to be that an industry where people are not allowed to express that sort of need for care for themselves, because as much as we are caring for patients all the time, you need people to care for you as well. It's definitely not an easy industry to be in, and not to make it sound like really doom and gloom, but there's a lot of death that we see in this industry, a lot of it. So we try our best to sort of remind people that you are a person with feelings, and you're seeing a lot of very difficult things to deal with, but mental health is such an important aspect of it, which is why part of the program is also like, keeping up with your physical health. Part of the program is to talk about personal health and wellness, dealing with stress, dealing with trauma, dealing with all of the things that you're going to see every single day. So yeah, but it's always something that we need to encourage and speak about more. I know that a lot of people, especially in the day and age that we live in now, there's a lot of encouragement to open up about, these difficult things, which personally for me is something that I would advocate for until the day I decide to leave, But yeah, I just think it's one of those things that we have to keep working at all the time.
Very, very true. So you have mentioned before that you have been to Switzerland with an exchange program. What was the exchange program about? And how would you say the medical service that side is different compared to ours, to South Africa?
Okay, so I went to Sweden. No, it wasn't Switzerland, but so the exchange program was part of a master's program because I am doing research and things like that. So we sort of got an opportunity to experience the research aspect and what kinds of topics are being spoken about in Sweden, but also just an opportunity for us to benchmark ourselves and see that as a university, as a country, if we're meeting the international levels. I know Sweden is a first world country, and their healthcare system is worlds apart from what we have here. But in terms of training our healthcare providers and being able to provide care in a way that matches what is seen in first world countries. That was basically the opportunity for us to be able to go there and have conversations with some industry leaders, some people who are pushing for better research to be published and things like that, that we're able to say that we have this industry that is kind of like a baby in terms of healthcare as a whole. I mean, if you speak about healthcare providers, people will always say doctors, nurses, and things like that, but paramedics are kind of like an afterthought of some sort. But it's to say that there's so much that still needs to be explored. There's so much that we still need to do to grow. But it was also a fantastic opportunity for us to see that as a country, as a people, we're not too far off in terms of the way that we train our personnel and how we train our people to be able to care for them. The only difference is obviously resource allocation. They have a different structure in how they deal with healthcare and things like that. But I mean, the standard is strong, and a lot of paramedics will know how sought after they are for good and bad reasons. It's unfortunate that in this country we have so much that we have to deal with. We have a quadruple burden of disease, which means that we deal with a lot of things in our healthcare system. We deal with violence and injuries a lot. We deal with a lot of HIV and TB. We deal with a lot of maternal deaths and infant deaths. We deal with a lot of cardiovascular diseases like heart attacks, strokes, and things like that. So the experience of a paramedic who was trained in South Africa is something that is very, very much valued and treasured overseas because of the experience that we gain. We see a lot of unfortunate cases, but it trains us to be able to handle, the really, really, really bad stuff. And so overseas, in countries like Sweden and countries like Qatar and all of this, South African paramedics are valued, treasured. And the only difference is that in Sweden, they don't have paramedics necessarily the way that we train them. They have, if you want to become a paramedic, you have to study a nursing degree, and then postgraduate studies then will lead you to becoming a paramedic. But other than that, it was an excellent experience, and I wouldn't have changed anything about it. It was fantastic.
Okay, so what are the emergency hotlines that people can call?
The number you can call from any cell phone, any network, it's a free number, is 112. You can also always call the police or the fire service, and they'll be able to also link you to any emergency services. But these are state services that you'll be able to reach via that number. But otherwise, there are a lot of private services that advertise their number, which I don't think I can really share without putting them on. They would need to pay you guys to be able to advertise their number. But the regular state number, 112, from any cell phone, any network, is the one that will get you help.
Okay. Thank you so much, Ncumisa, for being on our show. We really appreciate it. And Wanda, you can close.
Thank you so much.
Once again, thank you so much.
I feel like I spoke a lot.
No, you did well. Thank you so much for everything that you do for our community and for our country as paramedics and the first point of medical contact for our people. And thank you for educating us in this episode. Guys, if you enjoyed this episode, please like, comment, and subscribe. We'll see you guys in the next video. Bye.